Welcome back to the channel. My name is David Osuji, a psychiatric mental health nurse practitioner. This is third installment of my videos on the GLP-1 medication. This one is focused on the prevention strategies that you can utilize before initiating any one of the GLP-1 medications. So if you're going to be taking Ozempic, Wegovy, or any of the GLP-1 medications, this video could help save you the emotional roller coaster that could emerge with getting on GLP-1 medications. One of my patients told me, I've lost 40 pounds on Ozempic, but I don't feel like myself anymore. I wish someone had warned me that this could happen. In part 2, we covered why 1 in 3 patients experience these mood changes. Today, I'm going to give you my clinical playbook to prevent the mood instability before it even happens. Here's what I wish a lot of prescribers would prioritize: preventing the emotional instability rather than fixing it once it shows up. Think of it like a fire extinguisher. If you don't buy it and already have it on hand, it's hard to use it when you need it. Preparation is always better. And in my experience, most people who implement prevention strategies always fare better because they experience about 70% fewer mood episodes. Now, disclaimer, these strategies complement medical care, never to replace it. And you always want to consult with your prescriber before making any changes or implementing anything. So let's get into it. This is my evidence-based supplement stack to help complement your mood while getting on GLP-1 medications. Number 1 supplement is omega-3. Omega-3 with EPA DHA. This can be considered the mood stabilizer. Aim for about 2,000 milligrams daily and a 3-to-1 EPA to DHA ratio. Take it about 2 hours after your GLP-1 injection to prevent absorption interference. But obviously you take it every day. But on the day you take your injection, take it 2 hours after. Why? This supplement supports dopamine pathways, plus it reduces neuroinflammation. In fact, inflammation throughout the body. Supplement number 2, vitamin D plus K2. This can be considered your energy restorer. Vitamin D dose that you want to shoot for is 3,000 to 4,000 or even 5,000. So 3,000 to 5,000 IUs. And D3, you want to shoot for at least 80 mics or even better, 100 mics of K2. And for vitamin D, you want to complete blood work before you initiate so that you know what your baseline is. And once you start vitamin D daily, your target dose or target range that you want in your blood is about 50 to 70 nanograms per milliliter. So it's important to get tested first. Why is this supplement important? Weight loss can deplete vitamin D3, and vitamin D3 deficiency can lead to mood crashes. The addition of K2 prevents calcium buildup, and it also enhances vitamin D3 absorption. Supplement number 3, magnesium glycinate. This can be considered the sleep protector. You want to dose about 300 to 400 milligrams at night, 30 minutes before bed. Why is this supplement important? Because it activates GABA, your brain's calm down signal, and it helps to relax your whole nervous system. It also counteracts GLP-1 sleep disruption that many people might experience. Supplement number 4 is a methylated B-complex vitamin. This can be considered the neurotransmitter builder. And look for a methylated B12 at least 1,000 mics plus a methylfolate at 400 mics. Take it in the morning with food, not with your GLP-1 injection. It is critical to take the methylfolate, especially if you have the MTHFR gene variant. So, drug interaction alert. GLP-1 medications slow down gastric emptying. So you want to take all supplements at least 2 hours after the injection for optimal absorption. Now, let's talk about introduction protocol for these supplements. You want to add 1 supplement every 5 days. If you experience things like nausea, mood instability, you want to stop it and consult with your doctor. Now, let's talk about the strategy for when to inject or introduce the GLP-1 medication into your body. First point on when to take the injection is evening. Inject it about 3 to 4 hours after dinner, 2 hours before bed. Why? Because the peak drug effect hits during sleep, not during your workday. Most people report better mood stability when they take it in the evening. Secondly, introduce it during the weekend. Use the weekend as a buffer. So if you started Friday evening, it gives you Saturday and Sunday to adjust and to rest. Monday arrives, your body is already adapted to the medication. And thirdly, you want to escalate slowly. And this is critical. Week 1 or 2, you stay at the lowest effective dose and just monitor how your body is responding to it. Week 3, only increase if your mood and energy are stable. And by week 4, you should be able to gauge and know how it's affecting your body and your mood. Pre-injection meal strategy. Eat light protein plus complex carbs 2 to 3 hours before you take the injection. And examples of things you could eat is like Greek yogurt with berries or turkey and avocado. Why? Because it prevents the blood sugar crash that triggers a mood fluctuation. You want to set an alarm in your phone and be consistent with the day and time of your injection. That way, your brain likes consistency. Now, let's shift our attention to some mental health tools that you can use to navigate your moods and your emotions. Tool number 1 is the 5-4-3-2-1 grounding technique. And this is for emotional numbness. If you find yourself feeling disconnected or flat, you want to go through this list to engage your senses. 5 things you can see. 5 things you can see. 4 things you can touch. 3 things you can hear. 2 things you can smell. And 1 thing you can taste. This exercise works because it reconnects your nervous system to the present moment. It grounds you to your senses and grounds you to what's happening right now. Number 2 is to set an emotional intention. And I will explain what I mean. In the morning, you rate your mood 1 to 10. Then you set an intention. Like, today I want to feel blank. Now, throughout your day, because you set that intention in the morning, your subconscious is going to be searching for that emotion that you set up. And in the evening, you could journal 1 moment when you felt the target emotion. Let me explain with an example. If your goal was, today I want to feel peaceful, throughout the day, you're going to be searching for opportunities when you felt peaceful so that at night, when you reflect on your day, you can journal that peaceful moment down. Tool number 3 is an emotional weather report. This one is a little tricky because it helps you to recognize that your emotions are transient. Okay. So instead of saying, I feel off, I feel sad, I feel blah, you want to kind of put in a little more details, but paint it as a weather report. For example, it's stormy inside today with some clearing expected. It's mostly cloudy with brief sunny moments, right? When you paint your emotions as a weather report, it reminds you that the weather is transient and so also your feelings are transient. So before you feel off, you want to assemble your team. Before you get on the medication, you want to assemble your team. Medication safety net. First, you want to have a prescriber who has GLP-1 experience. Secondly, you want to have a mental health professional in your corner. Thirdly, you want to have a pharmacist who is familiar with all your medications. Now, you also want to have a personal support circle. One person who knows that you're on GLP-1 medication. Somebody who you could consider your accountability partner for mood check-ins. And you also want to have a trusted friend who can recognize when you're experiencing personality changes and be able to call you out on it. Now, additional support that you can have, a registered dietitian who's familiar with GLP-1 eating patterns, the sleep specialist, because GLP-1 medications can disrupt sleep architecture. Before you get on this medication, complete this checklist. Let me be completely honest. Even with perfect prevention, you might still notice some emotional shifts, and that's normal. The goal isn't to feel exactly the same. It is to feel like yourself while your body changes. One patient said it best. I'm still losing weight, but now I also feel like I'm home in my own head again. That's what made all the difference. And that's what I want for you. If this video prevents even one person from going through that emotional roller coaster that comes with GLP-1 medications, then I'm happy with it. As always, I'm David Osuji with Elevate Life Psychiatry, where your mental health isn't an afterthought. See you in the next video.